Most people think that fatty liver is a liver problem when it's actually a metabolic problem that shows up in the liver. And unfortunately, many people, they get their first diagnosis with fatty liver, and it's the first time they have any idea that they maybe have insulin resistance, metabolic dysfunction, inflammation. So today we're going to share our clinical pearls all about fatty liver disease, and we're going to talk about some really fascinating research related to fatty liver and a specific dietary pattern. So stay tuned for that. Welcome. We didn't introduce ourselves. Welcome to the Natural Doctors. I'm Dr. Jen Stagg with Dr. Katie Dinello. And we're going to just start off by maybe just checking in to see what's been going on in our lives this past week in clinic. Like, what have you been up to or seeing? Anything interesting to share with people?
What is interesting in my life? I feel like it's Groundhog's Day. Every day of my life, you guys. Today is a Tuesday night.
Oh, yeah?
We are in the studio twice this week filming because
we put off because I wanted to go to my daughter's final lacrosse game. Yeah. So I rescheduled. I was like, what do you think? And you're like, oh, yeah, of course.
Let's do it. Of course.
But so, now here we are in the middle of a double back-to-back. Okay.
Yeah. So we're filming 4 episodes this week, which is always really fun to be in the studio, right?
Yes.
But kind of puts the pressure on.
Yeah.
We kind of became Instagram famous.
Yeah. What is going on?
Over the last couple of weeks.
It's so weird because literally, like, we've been doing this for almost a year now. And this is what our social media guru told us, just keep on, you just keep doing the same thing that's not really hitting, and then all of a sudden it hits.
And I think for us too, because like we've been doing the Natural Doctors for about a year. I have been on social media promoting naturopathic medicine. I mean, you too.
Oh, me too, but like no one was paying attention.
No, right? For years. And I think, as two people who have been in this industry for a long time now, and we care so deeply. Like you and I both what's the word there?
What?
We were both on track to become like some type of conventional doctor, whether it was PhD.
I was like, I'm going to be an MD, PhD.
Yeah, exactly. Yeah. I thought I was going to be an ER doctor, literally took my MCATs, applied to conventional medical school. In that process, I was seeing a naturopathic doctor for really tough gut stuff. And I was like, oh my gosh, wait a second. Like, this is what I want to do, right? Like, kind of, we both had those moments of, we just really want to help people and spread this medicine. And this medicine, like, is the truth when it comes to health, like long-term health. And so that has always been our goal on social media,
100%,
right? Not to sell products, not to make a ton of money, although a little income would be nice.
For the amount of time we're spending,
time on this.
So hopefully YouTube, we hit the algorithm at least.
But really just to give people access to this medicine, because the reality is not every state, naturopathic doctors are not licensed in every state. So it is not a viable option for everybody.
Right.
Functional medicine has become incredibly expensive, which is a whole nother conversation. So our goal is really to just give people true, reliable, evidence-based content to help themselves. And so a larger following means that we are giving people that content that is helpful. So I think for us, that's what's gratifying.
And we've talked about this. It's so rewarding. The comments we're getting. I mean, you get some not so nice comments. It's social media. That's what happens. But I mean, I just answered a comment today on YouTube, and it was from a guy who was talking about like, oh my gosh, this is like, I'm so glad there needs to be a lot more education about insulin resistance. Like this should have been picked up on me years ago, and I've like had to like learn about it myself, and like thanking us for what we do. So like it's so rewarding, and it's exactly, his comment was like, this is exactly why we do what we do.
Exactly, 100%. So that's been really, really fun for us.
Yeah. Busy,
so busy. I know. I am tired.
Because we have plenty of time.
Right? Yeah. Exactly. I know. So you and I both were in clinic. We're seeing patients most days of the week. We both have children. I have young kids. Your kids are a little bit older.
Yeah. I'm dealing with graduation in the middle of this. Like my middle child is graduating.
It's a big deal.
And I'm on the field, like for graduation. I'm literally post the ceremony, and one of my friends is coming up to me asking about like the bagel reel.
Yeah.
And what do you think about a glycemic index of a bagel versus a donut?
Yes,
and you know, it's just hilarious.
It is. It is really funny. I had a patient in the waiting room today stop me, and she was like, oh, I love watching you on TV. And I'm like, oh no. But no, it's good. It's all really good. But if you haven't seen the bagel reel, make sure you go over to our Instagram page and check out the bagel reel.
Bagel reel. And then the other one, the big blow up reel was the 90-day plan to address insulin resistance.
Yeah, totally.
And that's important for what we're going to talk about tonight, but that one really resonated. That was the blow up overnight. Great job with that one.
I think
there was a lot leading up to it.
Leading up to it. And I think what resonated most with people based on their comments is just that it was digestible information. And this is what we talk about all the time with insulin resistance. It's like, you do not need to overhaul your entire life. Like we don't need to make this feel overwhelming. We just need to make a couple of really simple changes, and then we can have really good success with those changes. So good stuff.
Good. Yeah. So here we are talking about fatty liver this time. And so with fatty liver, okay, so if there's some terminology. So most people will hear fatty liver. Their doctor would say, oh, it shows some fat. You got fatty liver on your ultrasound. The official diagnosis is MASLD. It's changed. It used to be NAFLD, but now it's MASLD. Yep. So metabolic associated steatotic liver disease.
Yes, exactly.
Mouthful. This is why we don't say that.
Yeah, exactly. Right. And previously it was N instead of M, and that N stood for non-alcoholic.
Yeah.
Because previously, the main cause of fatty liver and eventual liver disease, fibrosis, cirrhosis was alcohol use.
Right.
But, that's still a concern.
It's still an issue, but this has taken over.
Yeah, because more in modern day society, right, there's the whole metabolic syndrome that's really coming into play. So that name change, we totally agree with. We support it because it brings light into what the true underlying root causes of the fatty liver are. So, and I think we should take a pause here, because one of my soapboxes is that we do not talk about fatty liver enough. And the number of times patients have brought me either, usually it's an ultrasound, but whether a CT or an MRI, and then there's just one line of like, oh yeah, fatty infiltration, right? And then I'm like, did your primary care doctor, whoever ordered this, tell you that you have fatty liver? And the patient is like, what? I have fatty liver? No one told me about that. And I'm like, oh my gosh, right?
Yep.
It's so frustrating. And I think a lot of conventional docs, and they're busy. We get it. So they're probably just like, okay, incidental finding, whatever. I don't have time to go over that.
Right. And a lot of times the context is like a patient's having abdominal pain. Right. They've gotten an ultrasound, and then they're like, okay, well, there's nothing on your ultrasound causing your abdominal pain.
Yeah.
Right. That's explaining your abdominal pain. So then they're saying, okay, it's nothing with your organs that's causing your pain. Let's see what else could be going on.
Yep. The other thing is too, what's probably going through their minds is like, well, this patient needs to lose weight and eat healthier. But it's like, okay, so talk to your patient about how we actually go about doing that.
Right. So, but unfortunately, then they're in the conventional model where they don't have enough time, or they're going to have the patient to come back, but then they still don't have enough time allotment. And a lot of these conventional practices don't have nutritionists on staff, all that sort of stuff. Right.
So
the
Yes.
conventional model fails here.
Exactly. So it really does fall through the cracks. So if you've ever had an abdominal imaging report,
Go back and take
go
a
back
look at
and
it.
look and make sure you don't have fatty liver. Okay, so yeah, MASLD, right? This is your metabolic dysfunction associated steatotic liver disease. The emphasis there on that metabolic piece. So tell us a little bit more of what is happening metabolic wise that causes fatty liver.
Yeah, so metabolic, this term metabolic syndrome, way back when I trained years and years ago, we were trained with this diagnosis of syndrome X. And it was, do you remember hearing this? Okay, so it was syndrome X. And it was like, ooh, what's this thing? And it was you meet 3 out of 5 criteria. And so that was an increased waist circumference. Let's make sure I can get them all. You fill in if I can. Elevated triglycerides, low HDL, elevated blood pressure, and then elevated blood sugar, not diabetic. So those are 5. And if you met 3 of 5 criteria, you have metabolic syndrome or syndrome X. Then they switched it because syndrome X sounds like, what the heck is that? So then let's describe this a little bit more, metabolic syndrome, right? So now we're saying metabolism, metabolic, and it probably should even shift a little bit more because it's really insulin driven, right? So it's the insulin resistance and all these things come along with it. And you're going, if someone had metabolic syndrome, maybe even if they had 2 of the criteria, I would be treating them because they're insulin resistant.
Definitely. Yep, definitely. And we know where that insulin resistance is going to lead if we don't put a pin in it and stop that cycle now. So, okay, the type of patient where I am thinking about fatty liver, because it's not like we're going to order an abdominal ultrasound on every patient.
Everyone that walks in the door is not getting that.
Right. So patients that I'm thinking about are patients who have higher visceral fat or are a little bit overweight, or not even necessarily overweight, but when we're asking questions about their lifestyle, they're like, yeah, I'm not exercising. I'm eating a lot of quick processed foods, refined carbohydrates, right? That's kind of the picture we're looking at. Even if they have, like you said, that low good cholesterol, which is that LDL, higher bad cholesterol or LDL levels, I'm thinking about them. Even if they're in that pre-diabetes range, so they probably already have insulin resistance if they're there. So that's the type of profile we're thinking about fatty liver for.
Right. Yeah. And we're certainly not going to be surprised if they end up with that. And then elevated liver enzymes. Did you just say that in your list?
I didn't. So let's talk about this.
Yeah. So then that's something that really would warrant this extra evaluation where we often are getting an ultrasound. And this can also happen, in any doctor's office. If you have routine lab work that's done at your primary care office, comprehensive metabolic panel that has liver enzymes on there. So we're talking ALT, AST, and they come back elevated. You're typically getting sent for an ultrasound to look at the liver. Okay.
Exactly.
Do we have some serious disease process going on? Is this fatty liver? Right. So in some cases, now you can have fatty liver and not have elevated liver enzymes.
That is true as well.
So that is where a lot of times that gets missed and then shows up. But those patients, we're definitely sending them for ultrasound and can, not all the time, but that's not uncommon then to show up.
Right, we're keeping our eye on that. Couple of other lab markers we can look into, a uric acid level. So it doesn't even have to be high, but we kind of have our own ranges there of what's suboptimal. Uric acid then kind of connects with fructose, right? And what's, that sugar and fructose metabolism in the liver. So that is a main contributor to fatty liver as well. So if you are a patient with gout, I'm also thinking about fatty liver for you.
Really good point.
Yep. And
then our PMOS patients.
Oh yes,
PCOS.
yes.
We're going to do an episode on this. It's coming up soon.
Yep, exactly.
Sleep apnea.
Sleep apnea is another one for sure. So yeah, there's quite a few patients that we're thinking about. Now, what I have kind of a practice changing moment for me in the last year is that I'm ordering what's called a FIB-4 on a lot of people. So
let's talk about that.
Yeah, so FIB-4 is a calculation that comes from different lab markers. So technically, if you are, you have a PCP, you go for your annual exam, you can usually calculate your own FIB-4 based on what labs they're measuring.
Right,
platelets,
but no one's doing that. There's no
one's
awareness
doing that.
about that.
Exactly.
Yeah. And no one's primary care doctor is doing that after the fact.
Yeah, but just for patients who have a doctor who won't order a FIB-4, right, just know you should go back in your labs, Google, because I don't know it off the top of my head.
But I'm sure there's a calculator for everything.
Yeah. So you can calculate it yourself. Otherwise, it's a very inexpensive calculation to add on.
But it's just, does that one have the platelets? Yeah, it's platelets in there too. But yeah, it's an easy enough test to just check off. So you can have like your comprehensive metabolic panel with FIB-4.
Exactly. Yep. And so I have caught fatty liver multiple times based on that test. And honestly, I wouldn't have necessarily, it wouldn't have been top of mind, top priority for a lot of those patients. Their liver enzymes are okay. Maybe some metabolic health stuff, but nothing glaringly like, oh my gosh, we should check you for fatty liver disease. Yeah. So
that's a really good point. I love that you add that.
Yeah.
All right, so let's, because we're going to, this is what happens to us when we get talking and run out of time.
I know.
Let's talk about the diet that we've been talking about for brain health. It's good for microbiome, gut health. And in this trial, so it's called the Direct Plus Green Med trial, it did show reversal of fatty liver, which is amazing in this particular study. So we have this study of about 300
just under 300
obese metabolic sort of profile patients.
Yep.
And they ate a green Mediterranean diet for 18 months.
Yep.
But they were divided into, they were divided into three groups. One group ate just a standard healthy diet. The second group ate a Mediterranean diet. And then the third group ate this green Mediterranean diet, which will qualify what that was.
Yeah.
But the outcome, they actually looked at fat using MRI in the liver. And so on the healthy diet, I wrote down the amounts here so we would remember.
Yeah.
Healthy diet after 18 months, a 12% reduction in liver fat. So that's good. That's showing, where you can actually get some movement there by eating a healthy diet. Mediterranean diet, a 20% reduction. Green Mediterranean diet, 39%. So it's 50% more. Basically, for when you go from 20 to 40%, we can call that 50% reduction in liver fat, which is amazing. So 40% of patients have that. Just unbelievable,
and over just 18 months, right? I know that might sound like a long time because we live in a society where we have instant gratification and we want things to happen quickly. But a year, just over a year and a half, that's, that is not a big deal at all. To reverse a potentially chronic disease.
Yeah,
it's
right.
Awesome.
Seeing
and
that fat.
Just through diet.
So just from diet.
And we talk about this all the time where our type of medicine right now, yes, there's supplements for everything. And sometimes we absolutely will use supplements for cases like this, but you can achieve this just through diet alone, which I think is very empowering for people.
Absolutely.
Yep.
Yeah.
So what did this diet actually look like? This Green Med diet?
Yeah. So the main things that were added on that makes the Green Med diet distinct are three things primarily. So first of all, it was green tea, and the subjects were drinking 3 to 4 cups of green tea a day. So now that's a good amount. Like most people who are green tea drinkers, 1 or 2 cups. I'm a green tea drinker. Usually 2, right?
Yeah.
But it's 3 to 4 cups is a good amount of green tea.
Yeah, it is.
Now, of course, we have patients that are drinking coffee, and there's lots of people drinking 3 or 4 cups of coffee a day, but not many that are drinking green tea. Yeah. So that could be an easy swap out. And you could still have coffee, and if you're a heavy coffee consumer, and switch out to 4 cups of green tea.
Yep.
The second big thing was walnuts.
Yeah.
A quarter cup of walnuts a day. Now that's pretty simple.
Yeah. Super simple.
Not hard to add.
Definitely.
And then the third part was mankai powder. Okay. So now this is an aquatic plant that grows in Southeast Asia. not really good sources available here for us in America. And so the closest thing that, I've started using is moringa powder. So, I mean, if we start getting good sourced mankai, we can start taking that, but moringa is a good thing. And then in terms of limitations, like obviously everybody was really limiting processed food, but the difference on the Green Med diet was much more lower reduction in red and processed meat, right? They're virtually like very plant forward on this diet.
And that was the main difference between the Mediterranean diet group and then this Green Med diet group was there was a lot less meat, still some fish in the Green Med group, but then more polyphenols and more plants. So it was kind of like a plant forward Mediterranean diet, essentially.
So I'm glad you brought up that word polyphenols because when we think about how this diet is working, those three things that I mentioned, mankai, walnuts, and green tea, are sources of polyphenols. So this is just, a chemical compound that's found in plants, very healthy, anti-inflammatory, antioxidant, good for our blood vessels, it does pretty much everything. But it affects our gut bacteria. Here we go again. Telling our microbiome story. But this is a big, and when they looked at it, the trial results, they could explain that there were shifts in the microbiome associated with the liver fat reduction.
Super cool. Really cool data there. And again, those polyphenols serving as prebiotics, right? To really enforce those good bacteria to stick around in the gut. So super, super cool data there. I really like this trial. Okay, so why don't we talk about what we actually do with our patients? So we've got this great study that came out, we've got this great data, but what does it look like in clinical practice when we have a patient with fatty liver? What's like the first thing you're doing? Is it diet? Is it supplements? Is it exercise?
So it's for sure diet because we're going to really focus on that glycemic load. So if you haven't watched our insulin resistance, diet for insulin resistance episode, go back and watch that because it's loaded in information about how to actually eat. So that's essentially the diet that I would recommend for patients that have fatty liver. But now with this information, I would suggest adding on, making sure they're eating walnuts regularly, getting green tea as much as they can get in, and maybe, moringa powder for some of these patients now I've been starting to recommend.
Definitely. I have a really, really similar approach too. So we will go through glycemic index of foods, which we have talked about. I will say we got a little backlash on Instagram of people not loving that we had kind of used the terms like good and bad foods, which, okay, I get it, totally. We can definitely be more conscious of that. And I would say when we are one-on-one with a patient, we are pretty conscious of that. Like, especially if my patient has a really sensitive history of disordered eating, right? Or we are really trying to improve our diet. I never want to shame a patient. So we are kind of shying away from that terminology of like, oh, this food is bad for you, this food is good for you, because at the end of the day, we all eat these foods, right? And so, but we know that there are better choices than others, you guys, right? And so, something to keep in mind there, but we are pretty cognizant of the glycemic index of food, especially for patients who have insulin resistance. And we like it because it is really easy for people to understand. People are so darn confused about food because there's so much information about what to eat, what not to eat. And so we continuously go back to that glycemic index, glycemic load, because it's a helpful tool.
It is. So then the next thing, we start there. That's our basis. Exercise. We didn't mention exercise. So important. Right? Obviously,
spend so much time. It has to be part of it, right? Like, and the way I tell people, I think the theme of the last week and a half for me in clinic has just been patients being like, I know I need to move my body, but like, how, and you don't feel motivated. And I'm like, you just do it. You just have to do it, right? But
I basically told a patient today that she kept asking for what supplements, can I add on some supplements? And I was like, I'm not recommending any supplements till you like commit to walking. And so we came to this agreement, like you're going to start 3 times a week. And then we're going to reassess in her, like she's on a GLP-1 and plateaued. but she's not doing any exercise and she's looking for supplements to boost her metabolism. And I'm like, no way.
No way.
You're going to exercise.
Exactly.
First.
Exactly. Yeah.
In a nice way.
Yes.
She knows I love her.
Of course.
So.
We got to dish the hard love sometimes, right?
But yeah, but supplements can be useful.
They can be.
There's some really good evidence with some of the supplements that, we'll mention here that can be really great additions to doing those basics.
Yeah.
But we will always point out, if you're not doing the basics, you can't expect this supplement now to turn around your fatty liver.
Exactly. Yeah. And we're not going to go into this too much, but berberine, we've talked about berberine before.
So helpful.
The reason why it is having such a moment on the internet is because it really is helpful for people, right? Vitamin E or annatto.
Yes.
This is a great one for fatty liver. This and milk thistle are probably my go-tos for really protecting that liver as we're doing all the other lifestyle pieces. And then we both love NAC or NAC and acetylcysteine. This is a really powerful antioxidant, glutathione precursor, so also very protective of that liver.
Right. Excellent. Yeah. Very safe supplements to take. So we love that. And then we would think about like more gut health here too, but we don't have enough time to get into that.
Exactly.
Will we end with some myth busters?
Let's see. I think weight loss is the only thing that matters. Listen, weight loss is super important, but you and I are both the type of doctor who's not going to blame every single thing on weight, because that's just not the case, right? So it really is that comprehensive picture that we talked about. But, weight's important, but it's not the full story.
Right.
And then fatty liver only happens from alcohol. I think it's a really good moment to just harp on what we said earlier, where it's like, yes, if you're drinking alcohol, you're going to get fatty liver, right?
Right. And we should point out that's also,
yes,
I have a patient that has a diagnosis of fatty liver. We're talking about alcohol consumption, and we're talking about Tylenol consumption. That's another big one that we've got to figure out ways. If they're relying on Tylenol for pain relief, we're finding other options, because that's not good for your liver.
Exactly. But is it the only thing? No, right? We've got that whole insulin resistance picture. So, yeah. Great. Anything else? I think we did it.
Yeah, I think if I look at the Mythbusters, we covered them all.
We covered them all. I know, that's usually what happens, right? Same with all of our listener questions that we have, we usually answer them somewhere in the episode.
Right.
So,
No, it was great.
Well, thank you so much for joining us. Fatty liver is such an important topic. It's something we see in clinic all the time. So we hope that this was useful for you. Go check us out. We are on all the things, TikTok, Instagram, but especially YouTube. Make sure you subscribe so you never miss an episode.
Nick Augustino right here at the East Side Restaurant. We always have the complete full dinner menu. Knockwurst, bratwurst, sauerbraten, potato pancakes, red cabbage, rice pudding, cream pies, all the desserts that Germany had to offer. I always do something different. Yes, I do. I brought seafood to the beer garden at the East Side Restaurant. East Side Restaurant, your German destination restaurant in Connecticut. Tiki-taka, hoy, hoy, hoy!
Nutmeg TV has been providing community television for over 30 years. We needed some studio upgrades, and Ion Bank believed in us. As a result of Ion Bank's financial help, we've been able to help others move on in a field that's difficult to get experience in. You're working with partners who understand who you are, and Ion Bank does that. They walk with us every day. It's community banking at its best.